The Emotional Wellbeing Teams in Kent and the Emotional Support Teams in Medway are part of a national programme called the Mental Health Support Teams. So the idea of us is that we work in schools, in partnership with schools, to increase access to early intervention children's mental health services, to help raise awareness around emotional wellbeing and mental health, and to work with schools to develop something called a whole school approach, which is the way in which schools develop an ethos and a culture within their school to talk about mental health and emotional wellbeing. We also are there to directly support with young people who are suffering with difficulties such as worries, low mood. So those very, very early kind of warning signs for emotional wellbeing and mental health difficulties.
But we get to build relationships with schools, parents, young people. We get to find out about what is going to be most useful for them, what they find most helpful. I think I always knew I wanted to help people, and it was a fact of trying to work out the best way of doing that. And I think one of the things that's really stuck out to me about this service and what drives me is that idea of early intervention.
Yeah, psychology graduate, did a master's, ended up on the training course for this, and here I am 3 years later, still here. Lots of positive feedback, and I guess that's the push to continue doing the great work we do, just to help the kids. That's what I aim for.
What I really like about this role is that I really get to use my psychological knowledge and my degree to I'm really using those skills I've learnt in this role.
Went and did psychology at university, and then I worked as a teaching assistant in a primary school for a couple of years, and it was really evident, especially sort of after COVID, sort of the impact that had on young people's mental health. So when I saw this role come up, it felt really perfect to be able to support more families and more young people with their well-being.
I think it's fantastic what we do, how many young people that we can help, how many teachers we can help, how many parents we can help as well. Just providing information about mental health and how they can really, even at home, how they can support their young people.
We are an early intervention preventative service. I get to meet so many wonderful people, and I get to help children and their families, so this is such a great position.
At the moment I'm an emotional wellbeing practitioner, but there's definitely lots of exciting roles, and opportunities to kind of develop my skills and sort of supervising and progressing to sort of a senior practitioner within the team.
I guess I can't recommend working with this service enough. I think it's exactly what's needed within mental health and wellbeing services.
We're here to complement what they've got and to make their access to the service as easy as possible.